Singer Michael Bolton this year announced that he has glioblastoma, a rare and aggressive form of brain cancer. In the U.S., roughly 70% of brain tumors are non-malignant or benign, while 30% are cancerous.
Non-malignant tumors are more common overall, but malignant tumors are more likely to be fatal. And today we've invited neurosurgeon Dr. Parham Yashar with Dignity Health Northridge Hospital to talk about all of this and give us some insight. Thank you for being here.
Thanks for the opportunity.
Yeah, let's just break it down pretty simply and talk about what is a brain or spinal cord tumor.
Sure. A tumor is just a collection of cells that are growing essentially uncontrollably. And that can happen over a very slow period of time. A lot of benign tumors can grow over the course of decades. You know, in fact, there's some patients who have tumors, have no idea they have a brain tumor. It's been there for maybe 30, 40, 50 years.
Wow.
I remember even one patient who got into a car accident, hit their head, so they got a CAT scan, and that's how they were diagnosed with their tumor.
With this, where's the tumor?
So that is the
tumor, obviously.
So to orient you, you kind of have to imagine this is a slice of the brain, and the very top of the screen is where the forehead is. So that large, white, kind of oval, almost circular shaped lesion is the brain tumor itself. That's a perfect example of a benign tumor called a meningioma.
Okay, so what are the symptoms of each, and who should go to the doctor to get checked out?
Great questions. Symptoms can vary. It really depends on a lot of different factors. Most important one is the location. So some tumors may be benign and completely asymptomatic. The perfect example was that case I mentioned to you guys. So a right frontal lesion may grow to the size literally of your fist before it causes any symptoms. Sometimes patients may have symptoms of speech difficulty, and that's because your speech centers generally are located on the left side of the brain, especially for a right-handed individual. And spinal cord tumors also depends on the location. If those tumors are affecting the nerves, they're compressing the spinal cord, you may have symptoms below the level of that lesion. So difficulty with balance, walking, which then leads me into worrisome symptoms. Headaches, a lot of people think headaches are the most common symptom. Not necessarily, but what are some of the concerning symptoms? Those are anything such as numbness or tingling that's new, especially if it's on one side of your body, difficulty with speech, if you're having some weakness, even for very worrisome lesions that are located in the brainstem, it can affect swallowing, it can affect your eye movement, your vision, double vision, and so on.
And what's the easiest way to detect them?
By far, if you get medical attention, is through an MRI. So an MRI will give you a highly detailed evaluation of a potential lesion. You know, an MRI, as you see on the video here, is a very detailed image study that looks at your anatomy. So if you give contrast, as we did on this particular video, a tumor, particularly in a meningioma, for example, can light up, and that's why you see that large white kind of clump of cells representing the tumor itself.
All right, so if a person has a benign tumor, how do you treat that?
A lot of different ways. I would say the most common way we treat benign tumors is just observation. A lot of benign tumors, if they're asymptomatic, they're small enough, they grow very slowly, you may not need any treatment. I have many patients in my practice with meningiomas. We just get an MRI on an annual basis. Other times, if it's small enough, we can treat it with a non-invasive type of treatment called gamma knife radiosurgery. And that has a little bit of a limit, usually 3 centimeters or less. It's a highly focused one-time dose of radiation treatment to essentially halt the growth of the tumor. And a lot of times you can see shrinkage of the tumor over time. And then in other cases, surgical resection or, you know, taking the tumor out is the best way to treat it.
So much technology these days. Can we talk about robotics and AI?
Absolutely. So in neurosurgery, there's a lot of different ways we can use robotics, both in spine and cranial neurosurgery, and also in endovascular neurosurgery, which is treatment of any kind of brain condition inside the artery. So we'll often go in through the femoral artery in the groin or the radial artery in the wrist, and we'll treat aneurysms that way, we'll treat strokes and unblock clogged arteries that way. So how does robotics play a role? Well, with spine, we'll use navigation and robotics to help guide the trajectory of spinal screws. For placement of deep brain stimulation electrodes, there's robotics that will guide these small little narrow wires that are smaller than your coffee stirrer.
Wow.
And there's rising technology. A lot of people have been testing it out for surgeons being, let's say, in another operative room or control room, operating robots, manipulating these different catheters, and doing endovascular treatments.
It is pretty fascinating. Thank you for giving us insight.
Thank you so much.
If you have symptoms, see a doctor. Right?
Absolutely.
Yeah. Okay,
Absolutely.
great. Thank you so much.
All right, let's get over to Kai.